In success, I guess I would see it as a combination of reducing the use of antibiotics and also, not seeing a negative impact in the following lactation on your bulk tank SCC and on your clinical cases. Both your clinical cases, both early in lactation and maybe after the cows have been dried. So that's also positive indication that there wasn't anything, substantially wrong with the drying off procedure as well.
Hello, I'm Stuart Childs and you're welcome to the Dairy Edge, the Teagasc Dairy podcast. We're bringing you the latest information, insights and opinion to improve dairy farm performance. Changes in legislation in 2022 officially brought to an end the prophylactic use of antibiotic dry cow tubes. However, while it had been well flagged, the Department of Agriculture took a soft stance in relation to its implementation last year. That is not going to be the case in 2023, and vets will be expected to only prescribe antibiotics where there is evidence of its requirement. This presents a challenge to dairy farmers as the level of attention to detail to dry off cows has to be very high, as the insurance of the dry cow antibiotic will be gone. Today I'm joined by Dr. Pablo Silva Bolona, mastitis researcher at Teagasc Moorepark, to discuss the findings from research that he has done into selective dry cow therapy. And I began by asking Pablo to just give a quick recap of what exactly selective dry cow therapy is.
Traditionally, as you know, herds have been doing blanket dry cow therapy, which means that they've been treating all cows at the end of the lactation with an intramammary antibiotic. This is usually very useful for treating existing infections, and it can help preventing new infections over the dry period. Now, with the coming of the new legislation, we can no longer use antibiotics as a preventive measure. Therefore, we cannot use the antibiotics to prevent dry period infections. So the term selective refers to selectively assigning antibiotic treatment to cows that are actually have an infection at the end of their lactation, so that we only use the antibiotics to treat existing infections and not preventing new ones. The cows that we are assessing that don't have an infection at the end of the lactation, they can be treated with another product, which is an internal teat sealant product, and which is an inorganic product that acts as a physical barrier that prevents the entrance of bacteria of the teat. That's the main concept of selective dry cow therapy.
Okay, so it's very important that people are clear that obviously the objective is to lower the amount of antibiotic usage. It's not actually eliminating it, so people can get antibiotics for the cows that will need it.
Absolutely, yeah. So with the legislation, first of all, there's like a requirement to have cow level information to guide antibiotic treatment. So provided there is evidence that shows that cow might have an infection, then that's justification enough for a cow to be treated with antibiotics. But it is no longer possible to be using antibiotic for all cows, regardless of their infection or their health status per se.
Okay, so when you say cow level information there, you're talking about milk recording. You and I are going to talk about milk recording, but I suppose just for some people that may have not stepped onto the milk recording train just yet, that cow level information is maybe going to be a CMT test, which the vet is probably going to have to do in order to kind of work with the vet in order to actually get antibiotics in that situation if they're needed. Is that correct?
Yes, I think that is correct. Ultimately, it does depend to the veterinarian to decide whether there is sufficient evidence to have, to give the cow antibiotics or not. But information that the vets can use can be, of course, the milk recording. But if that's not available, he can use the California mastitis test to identify infected quarters, maybe records of clinical cases that have happened not too far from the dry period. That could be another piece of information that the veterinarian uses for deciding which cows get antibiotic and which don't. And what we've used in research setting is taking quarter milk samples for bacteriology analysis, but that's super labor intensive and not something that commercial farmers would be doing, of course.
So I suppose just to highlight to people, so Pablo, really like the milk recording is actually the easiest way of doing this in reality.
Absolutely.
Because the CMT test an entire herd of cows, or as you said, the quarter sample an entire herd of cows, is very time consuming and very labor intensive. As you said, you need a lot of help to do it right. And people will actually get very frustrated with milk samples, I would think as well, that they'll find that they'll get contamination and all of this kind of stuff happening as well, whereas milk recording is much more straightforward way of doing it.
Indeed. Milk recording is the most useful and easy to get piece of information, and it strikes the best balance of reliable information and easy to get compared to the other methods for sure. So definitely, if the farmers can, they should do milk recording.
Okay, very good. So I suppose, as you said, the old way of doing things was the dry cow antibiotic across the board, and in vast majority of cases, a teat sealer with that. Some people may have not used teat sealers in that situation. They might have just used the antibiotics. But the vast majority of people were probably in the situation where they were using the dry cow antibiotic plus the sealer. Now you're asking people to just use the sealer. So, or where it's justified to only use the sealer. What are the risks, the major risks that are associated with going down the selective dry cow route?
The major risks are, first of all, are at dry off. If the procedure is not done correctly and very hygienically, there is a risk that the cows, might become infected with just by the fact that the person is putting in bacteria with the teat sealant. If the teat's not properly cleaned, then there's a risk that bacteria enters the teat with the teat sealant, and then there's no antibiotic to kind of counteract that infection. So at dry off, it's one of the main risks. The technique is important as well. If it's not properly applied, if it's not covering the base of the teat and the teat end, then it doesn't do its action of actually stopping bacteria coming up the mammary gland. So correct application, not letting it go up the gland, letting it stay in the bottom of the teat so that it can prevent the entrance of bacteria. That's another very important thing. And risks, because antibiotics do have, there are long-acting antibiotics, and they have an effect throughout the dry period. Because the cows don't have this antibiotic in their dry period management and early lactation, calving and early lactation management are also very important, because cows a couple of weeks before calving and a couple of weeks after calving are at a very high risk of having infections. And when there's no longer an antibiotic there, if management is not correct, then there's a risk of infections.
Okay, so that's the main issue, obviously, is that there's nothing in there now to do that preventative piece that you talked about, which is obviously the objective of the legislation, to stop that as well. Obviously, that you're not putting in something in anticipation of an infection. You're not putting it in because there's going to be no infection. So that surgically clean environment is the critical piece of this, I suppose. So you've done a lot of research on farm, and it's very important to point out that this is happening on commercial farms. This is not inside Moorepark where you're based. This is out on commercial farms. So I suppose not that there's anything wrong with Moorepark, obviously, but it's given it a more, it's obviously more a real piece of information in terms of different types of housing, different types of setups, different types of yards, different types of milking parlours from the work that you've done. So you've done a nice bit of commercial research there that's been published in the last couple of months. From the research work that you've done on the commercial farm studies, what are the most interesting findings from your perspective that people should be aware of?
As you say, we've done a good bit of trials on commercial farms. We've done control trials in the sense that we were looking at the effect of using teat sealant alone compared to antibiotic plus teat sealant in low SDCT cows. And we've also looked at farms that have been doing selective dry cow therapy for a number of years to identify what their risk factors are more important. And from those two pieces of work, I think, well, we've come across very interesting results. First of all, that the results or the outcome of selective dry cow therapy depends, I think, to the majority of its outcome, it depends on each specific herd. So what management practices are being implemented on each specific herd. So in some herds, we have found that there is no negative impact of using teat sealant alone compared to antibiotic plus teat sealant in low SDCT cows, whereas in others, it has resulted in higher SDCT in the following lactation and in higher infection levels. So that has a lot to do with what I was saying before, dry period management practices and early lactation management practices, because new infection around those times, those critical times, are very high. And if management is not correct, then there is a high risk. Another important piece of information that we found that was very interesting is that, yeah, using the last milk recording of the lactation was a good tool to decide which cows should get antibiotic plus T-Telan and which cows should get T-Telan alone. And from that work as well, we were able to identify which one was which SCC cut point could be the best threshold to select which cows get antibiotic and which don't. And from our studies, it turns out that for older cows, it's somewhere around 100,000, and for younger cows, it can be slightly lower, around 65,000, if I remember correctly. And so farmers can, or vets as well, who are making the decisions, can consider perhaps using a lower threshold for the younger animals if they feel that there is a high risk for that particular herd. There is some justification for that. And other interesting things that we found was that in the commercial herds that we surveyed, there was a large level of infection, a high level of infection in first lactation cows. And this could be a problem because these are animals that are just starting their production life, and if they get infections, particularly with Staph aureus, then they are not off to a great start, and they risk having that bacteria there for almost their entire lifetime, and also spreading it to other cows. So that's something that's important, that farmers should definitely pay close attention to.
And
And
how,
other things that, oh, sorry.
yeah, no, just how come, like you said, those first calvers are, they should by right be the cleanest animals coming into the herd, really, because
True.
they're completely new to the setup. How come you're fine? What do you think is actually meaning that they're coming back with this high cell count, or that they're showing up with this higher level of infection than you would have expected? I presume you would have thought exactly what I'm saying there, that the heifers should probably be fine.
Yeah, we were very surprised to see that. And well, just bear in mind that this was infections in late lactation. So we think that the majority of those originated early on in the lactation, but we don't know for sure because we only looked at late lactation, right? But still, these are animals that are still growing, still developing. Their immune system has not been fully developed. It hasn't been fully challenged to bacterial exposure. And when they're transitioning from the late pregnancy period to the early lactation period, they are subject to a high level of stress, a lot of changes in their physiology and everything, which makes them more vulnerable to infection. Their immunity is definitely reduced compared to older cows, and that affects their capacity to fight off infection. If you add to that in the majority of Irish herds, older cows are managed together with heifers in their calving, situation, and in their early lactation as well. Uh, and being that older cows usually are a reservoir for Staph aureus in particular, and that they can spread it to other cows, I think that combination makes it makes me think that that's what can be happening with these cows. So all those factors put together contribute to having a high level of infection in heifers, I think.
So basically, Pablo, what you're saying there is, we'll say maybe the close-up cows and heifers that are near calving, maybe on cubicles near a straw bed, are at risk because the older cows maybe start to leak even in spite of sealer or whatever. So that maybe milk on the cubicles that now has access to heifers that maybe aren't sealed in many cases, and that the infection is coming through there, and maybe also happening in the calving boxes themselves, then and group calving areas and so forth as well.
Yes, those two things can be a risk factor, and also like when they go in the parlor, if they go, they're mixed immediately or shortly after calving with the older cows. they're also a risk because one heifer might be milked right after a chronic cow that she's been high SEC since the previous lactation, and then the cluster or the milker's hands, have that cross-contamination of the milk, which may cause the cow, the heifer, get an infection.
Okay, so like that's another one of the management points that you're making. So basically, that we need to be managing in the parlor as much as around the winter housing, etc. as well.
Definitely, as much as possible. I know that for Irish dairy farmers it's a bit difficult to have separate groups of cows, for example, but in other parts of the world they do manage heifers as a separate group because of this risk that they have of becoming more infected. But anything that the farmer can do you know, uh, to prevent infection coming from older cows to younger cows is something that could benefit and reduce the risk. And keeping always in mind that, let's say the 2 weeks before calving and the 2 weeks after calving are critical times where both cows and heifers get the majority of their infections. So that's very important at those particular times to keep a close eye, I'd say.
So you've touched on a couple of different pieces there, but I suppose just to kind of the three things that people should really remember in relation to this piece of work now in terms of drying off cows for 2023 or for the lactation of 2024. And obviously, it's important that people bear in mind that what they do here in the next 2 months or 3 months as they're drying off is going to have an impact on their situation in early 2024, or whether they're going to have a stressful spring on top of an already stressful spring, maybe calving the cows. You
Yeah.
don't want to have mastitis problems at any stage of the lactation, and in particular at the springtime, because of just the challenges of, as you said, managing a lot of stock coming in together, parlor management, calves, all those kind of things to be dealt with. So what people do now over the next couple of months are going to be very important. So from the work that you've done, what are the three key things that people have to bear in mind to go about drying off cows for this 2023 going into 24?
Yeah, I'll try to keep it to just three, but because one could go to a great extent. First of all, maybe just as I think you touched on a very important point, maybe trying to think of the dry period and drying off as the starting of the following lactation rather than the ending of this one. So we're preparing cows for what's happening next. The dry period is also preparing cows what's happening in the following lactation. So it's key that we, I think, put that in perspective so that we can, get to a right start. The key three things I think all three things are management, to be honest. First of all, the drying off procedure needs to be as clean as possible. Making sure that cows' teeth are properly clean, especially if they're going to be treated with teeth sealants alone. But the level of cleanliness needs to be, clinical, as you said, almost surgical, as you said, so to prevent any risk of putting infections in the cows. We found with our research, and I didn't say this before, but that maybe cows that were yielding have higher yields approaching dry off might be at more risk if they're treated with teeth sealants. So applying some strategies, but preferably nutritional strategies to reduce their yields towards drying off, particularly if they're going to be dried off with teeth sealant, could be good. Then during the dry period is an early lactation management is super critical. Our research showed us that for farmers that were cleaning and liming the cubicles twice per day had lower SCC cows in the following lactation compared to farmers that were doing it just once a day. So keeping the cubicles as clean as possible, and keeping in mind as well, if cubicles are overstocked, then it's going to be much harder to keep clean. So probably the frequency of cleaning of those cubicles is going to need to be higher, and that's very important. Around calving, if you can, prevent mixing up heifers with older cows could be important. And in early lactation, keeping, your milking management practices optimal so that there is no spread. So trying to avoid spreading infections with your hands. So keeping hands and teeth while milking as dry and as clean as possible. and correctly applying post-milking teat disinfection, because it's one of the most effective practices as well, shown to prevent the spread of Staph aureus infection. So that's very key, is doing the post-milking disinfection, doing it very consciously, that it needs to be properly covering all the teeth. And the last message, if I may, is for selection of cows, milk recording is the best piece of information. Farmers can do, let's say, if they're not doing any milk recordings, they can maybe start with one towards the end of lactation, maybe within 30 days before drying off. That would be useful to them to make decisions on which cows get teat sealant and which ones get antibiotic. But the more milk recordings, the better, in terms as well of mastitis management and making decisions on whether to cull or to keep the cows in the herd as well. So the more milk recordings you can do, the better.
Okay, so I suppose just to end on a really positive note, Pablo, like this can be successfully done, and we've numerous examples of it, and in some cases, some quite large herds actually doing lots of cows with sealer only. I suppose what you mentioned, I just wanted to pick up on one thing that you said there in terms of the nutritional management to reduce the yield less than 15 kilos, I think you said. I think what your point there is that going once a day isn't probably a great idea to reduce the yield in order to dry cows off, and that's why you're emphasizing that it's nutritionally managing to reduce the yields that you're talking about there, I presume, is it?
Yeah, that's correct. According to Teagasc research, doing once a day towards a late lactation does increase, substantially SEC levels. So I wouldn't be inclined to go once a day in that particular time of the year. And
Okay,
just focus on the nutritional side of things. Yeah.
okay, and as I said, sorry, I'm doubling back now, but in terms of the positivity or the positive message in relation to this,
Oh yeah.
this is successfully being done on many farms. What's your view on it in terms of what does success look like in this on commercial farms? Is what kind of a percentage, or is it the appropriate percentage done every year is what success is, if you know what I mean? And it's that number, like you said, they're getting the balance right between the selectivity and the sensitivity of the number that you pick, so that you maximize the number of cows that do get the sealer only treatment, but that you don't miss the infections that might be potentially lying there as well. So what's your take on success looking like it for a commercial farmer listening to us?
Yeah. So going back to the positive message, yeah, it is very possible to do this practice without, negative outcomes or without any negative impacts. We saw that even when farmers were selecting their cows using a 200,000 cup point for SEC. So even then, some farmers did quite well. There was no negative impact of using teat sealant in the following lactation. So it's very possible if management is on point. And success, I guess I would see it as a combination of reducing the use of antibiotics and also, not seeing a negative impact in the following lactation on your bulk tank SEC and on your clinical cases. Both your clinical cases, both early in lactation and maybe after the cows have been dried. So that's also a positive indication that there wasn't anything, substantially wrong with the drying off procedure as well. If you're seeing a lot of clinical cases early in the dry period, then that could be an indication that there was something wrong with the procedure itself. And just again, to give a positive note, in our studies where we surveyed more than 20 commercial farms, there were farmers that were doing, over 80% of their cows with teat sealants alone. And, they didn't have problems in the following lactation. And their bulk tank SEC was always under 200,000. So it is very possible to implement this practice in a successful way. Absolutely.
Okay, very good. And I suppose just finally, we'll remind people that there is obviously support there through the AHI funded TESA program as well, in relation to people that are maybe going down this route for the first time. They can contact our vets about doing a consult with them, and to make sure that they take the right steps and pick the right cows and so forth. And obviously people are there to help, and people shouldn't do this without help. So thanks a million for coming on today, Pablo, and for sharing your knowledge with us. Okay,
no problem at all.
That's all for this week's episode of the Dairy Age podcast, and my thanks to Pablo for joining me on this week's show. Don't forget to rate, review and subscribe to the podcast. You can listen on Apple and Google Podcasts as well as Spotify. And for more information, go to the Teagasc website at teagasc.ie. I'm Stuart Childs, and join us next time for your Dairy Edge.